Hi, I'm Lance DeLange with Yada Yada. Do you find yourself having your fingers get stuck down, one or several of your fingers, getting stuck, and perhaps in the morning you have to take your hand and open it back up? Do you feel pain in your hand with gripping? If so, perhaps you have trigger finger and you're going to want to watch this video. In talking about trigger finger, it's important to understand a little bit of the anatomy. The tendons that flex our fingers come through a structure called the A1 pulley. As we bend our hand and fingers, part of the mechanism to do so is the tendon comes underneath here. The tendon has to go underneath this sheath called the A1 pulley. As it's sliding back and forth this sheath, it can get stuck, hence causing a triggering reaction when you extend the finger. It's not uncommon for people who are experiencing trigger finger to notice that they wake up and perhaps one or more fingers are in a stuck down position. Perhaps with extension and a little bit of effort, you might feel a pop and the finger rapidly triggers into release. Other times, you may be required to take your hand and physically open it back up. Doing so, you may feel a pop or a release feel as the tendon then slides under the A1 pulley. The tendon comes under this pulley and it should slide freely. It may get stuck, and in getting stuck, it can then release quickly, which causes the triggering event known as trigger finger. Common symptoms include pain to palpation over the tendon. Any of the fingers and or thumb could be involved. It's very common to have tenderness in this location. If you're not sure if you have trigger finger, an easy way to check would be to find the A1 pulley located at the base of the specific affected finger, and if you were to push or squeeze in that area, that would be a very tender location to do so. You may notice that it gets stuck down from time to time and then snaps and it releases. You may notice it gets stuck down and requires a significant amount of effort to do so. It's common to perhaps get pain or discomfort in the joints just distal to that finger. As the finger flexes and extends, if it's getting caught in the A1 pulley and does a quick release snapping motion, that could cause pain or discomfort in those fingers. Because those fingers, those joints are meant to glide smoothly with motion, the triggering of the A1 pulley would cause more of a quick, rapid jerking motion, which then can disturb those joints, particularly if perhaps you have arthritis in those joints. It's not uncommon for people to feel perhaps their symptoms are coming from these joints when in fact it may be coming from the A1 pulley. Here I have an example of a hand showing just one tendon. Coming up through the hand, as I flex my finger, if this guy were to flex this index finger, it is this flexor tendon that would cause this motion. Sitting in this location is what's called the A1 pulley, and this tendon must slide underneath it. This triggering in this location is what causes trigger finger. It's very common to get trigger finger with a repetitive activity, such as repetitive typing or a keyboard or a guitar, construction worker. Any activity that causes recurrent motion can produce trigger finger. It's an inflammatory response that limits the tendon's motion in this location. So if you feel you have trigger finger, what does that mean? Symptoms typically are more of a nuisance than anything. It can last for a few minutes, it can last for a few days, several weeks, or months on end. Often people can find relief by using an anti-inflammatory. There are oral over-the-counter anti-inflammatories. There are topical creams as an anti-inflammatory that could be massaged directly into that location. Icing could particularly help after a busy day or activity. It's often noticed that trigger finger is worse after a repetitive activity, more so than during the activity itself. Perhaps you're doing some hammering or gripping at a construction site. While it's warmed up and mobile, you may not notice that you have any symptoms. Later that afternoon, or perhaps overnight or the next morning, you may notice that it's become tender and the finger seems to be getting stiff. Perhaps after you release it and get it moving, it loosens up and does better, perhaps for a few hours or most of the day. So there's several things that you can do for it. So there's some physical therapy activities that can be performed. You could seek out the help of a physical therapist or even massage therapist. Anti-inflammatories, either topically or an oral anti-inflammatory, can help. Icing after an activity can control the inflammatory response. For example, if you got up in the morning and the hand was stiff and locking, you might flex and extend it, get it warmed up. You could even put a heat pack on it to loosen it. However, it will likely bother you again later on, particularly after it's cooled down, so ice might be more appropriate after your activity. If it's more bothersome than this and you're seeking further help, a few other options could be performed, particularly by a qualified healthcare professional. An injection of a cortisone could be administered in this location. Cortisone would calm the inflammatory response and limit the amount of pinching and triggering that can occur in this location. It is possible for an injection or the other conservative modalities to resolve your symptoms without further need. Other times these treatments might be unsuccessful and you might require a surgical intervention. If this was needed, an orthopedic surgeon or hand surgeon could perform a surgery with a small incision over the A1 pollia location, typically in a flexor crease of the palm depending on the finger that was involved. And this A1 pollia can be released, surgically removing the triggering obstruction of the A1 pollia, freeing that up for the tendon to glide freely. What treatment option may be best for you, or perhaps may be best for one finger, may not be the same for the next. So if you feel you may have trigger finger and your symptoms are not being relieved by these simple treatment options, please seek out further medical help from your qualified healthcare professional. You don't have to suffer with trigger finger. It can be a nuisance and it can go on for a long time. There are treatment options. So if you feel you need further help, please seek out a professional to help you. Thank you for joining us today. Hope you have a great day.